Hi, my name's Rachel.
Hi, I'm Turk.
Nice to meet you. So today we're going to test your resting heart rate. Now to get a true reading, that's why I've had you sit in this chair for 3 to 5 minutes just to make sure that you're completely at rest and that you haven't been doing any activity prior to this. So the reason that we test heart rate is because we want to make sure that you don't have a really high resting heart rate, as that can be a sign of a pre-existing condition.
Like what?
Okay, so if you have a high resting heart rate, that can increase the risk for stroke and cardiac arrest, which can actually, the risk of it can be increased with physical exercise. So we just want to make sure that that resting heart rate is in the normal range, which is between 80 beats per minute and 100 beats per minute, just to make sure that we're good to go in that area for exercise.
Does a high resting heart rate also mean that I have low cardiovascular endurance?
Yes, it can be an indicator that your cardiovascular endurance is low. If at resting it's really high, which means that when you are exercising, it would increase substantially.
So does that mean I have to go see a doctor before I can go exercise if I have a high resting heart rate?
If you have a high resting heart rate, you do not need to go get medical clearance from a doctor, but it is something that we want to keep an eye on because we don't want to send you into any kind of exercise program without knowing the risks that we have prior to. All right, so now I'm gonna test your resting heart rate, if that's okay with you. If you could put your wrist on the table, your right wrist. If it's okay with you, I'm gonna take my 2 fingers and press on your wrist on the radial artery right below your palm.
Sure.
Okay, feel on your radial artery. Okay, so I went ahead and I put my 2 fingers on your radial artery and I counted the beats within the amount of time of 30 seconds, and it was 40. So I'm gonna take that number by 2. So that your beats per minute is 80 beats per minute. And that actually is within the normal range. So we are good to go on that, and next we'll do your blood pressure. So we tested your heart rate. Now we're gonna focus on your blood pressure. Blood pressure is a very important thing that we test for prior to exercise. High blood pressure can be an indicator of an individual who's really stressed, and that can be like in your job setting or your school setting. It can also be an individual who eats a bad diet, high in sodium or bad fats, and also being obese can result in high blood pressure. For those with high blood pressure, eating a healthy diet can lower blood pressure, as well as exercise and doing anything and everything to reduce stress. Alright, so we're going to test your blood pressure. With your permission, I'm going to put this cuff on your arm. Okay? Roll this sleeve just a little bit. Now, when we place the cuff on the arm, we're going to do it right above the bend of the elbow, making sure that this arrow that says right arm lines up with that brachial artery. Now, what I'm going to do is I'm going to increase this pressure, and I'm going to pump it to about 180. Now, once we get to 180, I'm going to start listening with my stethoscope. And the very first heartbeat I hear upon releasing that pressure is going to be your systolic number, which is on top, which in normal range is usually 120. And then the very last heartbeat I hear upon releasing pressure is going to be your diastolic number, which is on the bottom, and it's typically around 80. Start that. I'm going to make sure the stethoscope is on that brachial artery. Okay, so what I got was 120/76, and that is within healthy range, which was typically 120/80.